You actually painted very vivid portraits of the types of personalities that you see having a career in brain surgery. And I just remember, actually, as we're talking, a book that I read a few years ago, I think was called When the Air Hits Your Brain. And I think in that book, they kind of portrayed brain surgeons maybe as jocks or kind of high achievers. So where does your assessment lie? Like, what types of people maybe go into the profession, and what common traits do you see in people who really excel or become great surgeons, like you mentioned earlier?
So yeah, I'm going to create the analogy of like the high school lunchroom. Different people sit at different tables. So you have the nerds at one table. You have the musicians at one table. You have the jocks at one table, and there's a lot of things that push people into neurosurgery. And there's definitely some people who are athletes who like the physical challenge. They're type A personalities. They don't run away from challenges and conflicts. But there's also nerdy brain surgeons who are interested in the science and how the brain works. And then there are also, musicians who practice their instrument. It's a technical feat, something that you are used to sitting down and becoming better and better at using your hands and your fingers, and they can be very good neurosurgeons. There's some neurosurgeons who go into it because they were touched by neurosurgery. So they have a family member who died of an aneurysm or a brain tumor, or maybe they have a family member, a parent who went into neurosurgery. And so they want to follow in their footsteps because they admire that person. Or you have minorities and women who sometimes are facing challenges and feel like they need to prove themselves. And because neurosurgery is thought of as being a very hard thing to do, which requires a lot of sacrifice and difficulty, and has previously been dominated by white men, it becomes a profession that some may be motivated to go into because they feel like they're representing a group and they want to show their ability to achieve as a representative of that potentially previously underrepresented group in neurosurgery.